I got it.
Right. Okay, so here we go. So now so I do this. That puts him on.
Yeah, but I don't know why. Either of your videos.
What happened to you?
Turn this off.
I know.
You just got kicked off.
I saw that.
Want to try again, or?
Yeah, no, I pressed join, so it's trying to connect.
Okay.
Yeah, you're live.
Right, we're live. All right, ladies and gentlemen, we are just waiting 1 minute to get connected here. I'm just gonna... We are getting ready here. Doc Riggs is getting set. Doc, you are on with us right now?
Am I?
No, I'm asking. Are you?
It's still saying connecting.
Okay.
I logged out.
Right.
Oh wait, you know what? Let's do this.
Yeah. Why is it not showing me? Oh, right. Of course. Okay. All right. Are you good, Doc Riggs? All right, give us 1 second, everybody. We are getting ourselves ready here. I have to do this. Give us 1 quick second, and we will be starting our show. Thank you for being patient with us. We do appreciate it, as always. How come this didn't save? I saved it. Oh, I did not. Desktop. This is what happens. This is what happens when you're community and you go live on a community manner. All right, we are still waiting for. Oh, there's Doc Riggs. All right, there he is. And all right, Doc, can you hear us?
I absolutely can.
All right. It is great to. It's great to see you.
Great to be here, sir.
That's right. And it's awesome that you're here. Welcome folks to the NoiseFilter daily COVID-19 show. We do this every day, Monday through Friday from 4 to 5. This is my name's Dr. Derry. That over there is Doc Griggs, and it's a pleasure to see you, Dr. Griggs. Doc Griggs and I do a regular podcast that's a daily morning podcast. You can find that at NoiseFilterShow.com. You can also find that at all your favorite podcasting platforms. It's 10 minutes, high yield, and Doc Griggs and I attempt to, I'm funny. Let me just say that Doc Griggs really does do his best to try to keep up with me. Doc Griggs, how was your day today?
So it sounds like you've been cooped up a long time to the point that you're laughing and hearing your own jokes. Folks, if you only knew the jokes he was telling in his head, be glad that you can hear them.
I'm trying to be fancy here as I am learning. Oh, I see. Okay, got it. Doc Griggs, how was your day today?
Very good. A little warm outside, but no absolute complaints at all. I saw a lot of people wearing masks. It was a good thing. Today was a good day. Very good day. I breathed, I checked, and now I'm stepping back to enjoy our presentation.
I wish that I could have seen people wear masks. I have not, unfortunately, seen people wear masks at all, and I am needing more and more of you guys to please wear masks. Remember, my mask protects you, and your mask protects me. Mask up, COVID down. It's so important for all of us to be wearing masks. Doc Griggs, before we get started on our slideshow, any words, any thoughts?
No, I want to make sure that people are paying attention, particularly in the slides today. When Doc brings up Brazil, pay particular attention. If you understand the relationship of the northern hemisphere of the planet, that's the top, versus the southern hemisphere, the seasons are somewhat flipped. So as you're looking at what's going on in Brazil, I want you to understand, if I'm not mistaken, it's their fall winter, which we have on the way. So when they say there's a second wave, understand that we're not out of the first one yet. And when the second wave comes, we will be worried about the other respiratory viruses, including flu, that we worry about every year. So it's important that we wear our masks, decrease our load, social distance, and stay home. And of course, Doc, this is just for you, Doc. We wash our hands. I used to make fun of him for being so obsessive about it, but now, of all people, I'm going to ask him for another bottle. Yeah.
Yeah. Who gets the last laugh now, right?
Yeah. Don't you have some slides or something to do?
We do have some slides.
531-6006.
Let's go ahead and get started here. We do have some slides that we need to go over. Doc, whenever you're ready to give us a new picture, I am very, very happy.
Can we just lose it? Why is it cropped? Why are you photoshopped? Can you just, can we just move on, please?
Oh yeah, wait a second. Oh, you know what? That's a good point. Let me see. That is, maybe I have to do that. Hold on. Wait a second. Right. There we go. Okay. I am doing the producing of this by myself. So, all right. Does that look good? Doc? Eric, are you there? Did I lose you? Hold on one sec. Can I not? What happened to Eric?
He's turning his video off.
Yeah.
You turned him off.
I turned him off, right? But I can't. Eric, can you hear me? Can you talk?
I think he turned his volume.
Yeah, dude, don't turn your volume off. I need you. Eric. Hey, can you check and see what's going on? Hey, Graham? Graham? All right. We are going to get started here on slides. As you guys see, we are learning some new technologies. And for some reason, it looks like we lost Doc Griggs. I'm waiting for Doc Griggs to get back here. In the interim, we're going to just go ahead and just start our slides here. As you can see, can you make sure he's, yeah, all right. As you can see, we are well north of 5 million cases, 5.1 million global cases. In fact, yesterday we had the highest case rates in the history of COVID-19, which of course, admittedly, is not very much. We've had about 332,857 deaths. You can see we added 83,000 cases. And then you're going to see tomorrow, we're going to see over 100,000 cases that are going to be added. Those are the numbers that are coming in today. Number of deaths for 3,618. So that's good. Usually we see about to 5,000. Can you talk? I'm sorry, Doc Griggs is reaching out to me. For some reason, Doc Griggs' volume is not coming in. Let me see if Doc Griggs.
I am here.
Okay.
I'm here. I never left.
I understand that, but I guess we're just trying to figure something out. So I'm gonna flip back to here. Now, can you talk again? So I guess what we're finding out, I guess as we are learning something new,
yeah.
When this is on, apparently, I guess we're learning as we go here.
Yeah, it's COVID. We live in a pivot. Something new every day. We're good. Keep going.
All right. Well, what I may do is I may do something like this, and even though, let's see how that works. Yeah,
it looks good. It looks really good.
All right. So and I appreciate that. So as you can see here, our number of cases are definitely are going up. I mean, I think that's obvious here. But when we look at the cases, we can definitely see for mortality, we can see that mortality is definitely going down. That's what this appears like here, and this is great. So again, Doc Griggs, it appears right now our caseloads are going up, and then our mortality is going down. Any thoughts on any of that right now?
So that's a careful statistic. Your case number goes up as you do more testing, and as you do more testing, you can. At first, we were all back in March, we were testing the most sick, which means our mortality rate was a lot higher. And as the virus spread, it got naturally. It was a raw, real number. As we counted, there were more deaths, the whole nine. So as we increase testing, you have to be careful about the mortality rate because it can get diluted somewhat. Yesterday wasn't that one of the most deadly days that we've had in the country?
The most number of cases.
It was the most number of cases. Yeah. Right. So the number of deaths, again, remember that every number you see is attached to a person and or a family. So it's good to watch these trends, and the numbers that you're seeing now are the results of what we did a couple weeks ago, which was around Easter time or so.
That's right. So good. All right, we're getting our groove down. Griggs, Doc Griggs, I usually don't like to do this, but there is a Claudette Griggs that would like to say hello to you.
Oh, that's my cousin. Hey, cuz.
All right, so going to the U.S. Number of cases. What's obvious here is you can see we are reaching greater than 1.6 million cases. And boy, oh boy, are we reaching that 100,000 cases. You can see we added about 21,000 cases, almost 22,000 cases yesterday. And then in terms of mortality, we added 1,114, which works out to be about 2 deaths for every 3 minutes. Of course, we are rapidly approaching the levels of World War I. You can see here's Korean War levels, which is about 54,000 deaths. Vietnam was 56,000. And then here for World War I, you could see we are about 116,000. When we go back here, we're at about 96,000. So we're very, very quickly going to be approaching World War I cases. These are military deaths. These, of course, are of military, U.S. military deaths. Of course, this does not take into consideration other military deaths from other countries, and of course the thousands and thousands, hundreds of thousands of civilians. If you look at the U.S. number of cases, the epi curve is definitively going down. There looks like there may be a little plateau. And what I am particularly concerned about is that this plateau may turn into a number of cases going up. We are seeing cases, and we are going to talk about that a little bit later. We are seeing cases that are starting to come up a little bit, and especially in some rural parts of the country. So what I'm hoping is that I'm hoping this is going to turn into a plateau rather than that this may ultimately look like a valley. When we look at the mortality, I'm very, very happy to state that this line definitively looks as though it is definitively going down. And so that's very good, and I hope that mortality continues to go down, and I hope that is going down specifically because we are getting better at being able to not only identify, get folks to the hospital early, and of course, more than anything else, is we're better with treatments. This is looking at testing. You can see here, let me see if that helps with the resolution here, just barely, huh? We're just still trying to figure out how to use this and use this software. You can see here, Iceland, now Gibraltar does the most testing, 173,000 tests per million. You can see the U.S. is somewhere like at 39. And we're about 40,000 cases per million in terms of the number of tests that we do. We definitely need to do a lot better when it comes to testing. For the amount of problems that we're having, our testing should be significantly better. This is looking at the total number of our positivity rate for tests. This is the number of positives, so that's about 1.5 million. This is the total number of negatives, about 11 million. When you add these two numbers together, you get about 12.6 million here, and that gives us a 12%. This gives us a 12% ratio. In other words, our positives divided by the total positives and negatives gives you about 12%. We want that to be about 5%. And so what this still tells us that we're only testing people who have a high pre-test probability, and we definitely could be doing a lot better there. When we're looking at the state of Louisiana, which is where Doc Griggs and I are based out of, as you can see, we have our case rates are about 36,500, with about almost approaching 2,700 deaths, with Jefferson County and I'm sorry. Ooh, dude, did you just hear me just say that?
Parrish.
Should I have my my
No. Keep going so we don't revoke your card. Your license.
With Jefferson Parish and Orleans Parish really leading the way. And you can see Jefferson is really breaking away from Orleans. For those of you that aren't from here, obviously we call counties parishes. There's no such thing as a county in Louisiana. They're called parishes. Jefferson Parish is right next door to Orleans Parish. In fact, if you ever fly into New Orleans, you're actually flying into Jefferson Parish. So you can see that Jefferson Parish is really pulling away. They've added 80 cases overnight. We added 35. Orleans, we're broadcasting from Orleans, added 35. And you can see last night in Louisiana, there was a total of 44 deaths. 2 coming from Jefferson and 2 coming from Orleans. You could see, this may be hard to see from this, but you can see our case rates are more or less stabilizing for the state of Louisiana, right about there. And then when you look specifically at our mortality rates here, it looks as though this is continually going down, which looks great. Before we start to wrap it up, let me just go over our case rates in the state of Louisiana. We are 1, 2, 3, 4, 5, 6, 7, 8, 9. We're still 9th at 7.8 thousand cases per million population. When you look at our mortality rate, we are 1, 2, 3, 4, 5, 6. So we're still unchanged, about 566 per million. Again, you look at New York, New Jersey, Connecticut, Massachusetts, and District of Columbia. We are the first country in the South, and again, largely due to poverty and a disproportionate number of cases, especially mortality, that happen in communities of color. In terms of testing, we are 1, 2, 3, 4, 5, 6th in the country with 65,000, almost 66,000 tests per million. We've done a total of 300,000 tests. We want to turn that into 200,000 per month. Before we start continuing on with some of these other slides, Doc Griggs, I wanted to see if there was any thoughts that you had so far with what we have talked about.
So the first thing is I want to go back to the number in the country, because earlier this week you predicted by the end of the week that we would be at 100,000, and we're what, at 96,000 right now?
Right. So we're getting there, right?
Yeah, and I need to make mention. I'm not sure what stories that you have up right now, queued up for us later, but can we talk a little bit about Montgomery and the spikes that are going on in rural areas?
Right. So that's definitely coming. So those are definitely going to be coming.
So when people look at these numbers from the reports that I've read and what I've seen, is understand that the issues when we talk about Montgomery aren't necessarily coming from the dense urban areas. They're going to be coming from the rural populations that we've spoken about for the last few weeks, understanding and reinforcing the fact that the virus doesn't spread the virus. It's people that spread the virus. So when you get people from rural areas going to places where there are potentially super spreader events or congregations of people close together, they can unknowingly take it back to their separate rural communities and spread the virus as they don't observe social distancing and wearing their face mask and washing their hands. Nothing's changed from the perspective of the virus, science-wise. It hadn't learned any new tricks, or it's constantly trying new tricks, but nothing's changed even though we're out. And that these numbers that you're seeing are the results of what happened a few weeks ago. So the good things with the flattenings of the curves, but the potential spikes are when people started trying to congregate and they got a little too comfortable. So in times of war, prepare for peace. In times of peace, prepare for war. We have a second wave that's going to be coming, and we need to prepare for that. And if you need an example, look at what's happening in the southern hemisphere here in our region of the world, because the seasons are flipped. And we'll talk about that more later. Doc?
We will be talking about that actually very, very soon. In fact, let's get back to what we were talking about here. And let's get to some of these slides here. I wanted to kind of remind us about what the R naught is. This is looking at our infection rate. This is the R naught, and what this is showing us is this is looking at what the infectivity rate is for Louisiana, and we're just about 1. What happens if we cross this line right here is that means one person with COVID can infect another person with COVID. And let me just kind of blow this up a little bit more here. And as you can see, again, once this number crosses 1, and you can see that the error margin, the margin of error already is crossing that, and it's crossing into 1.2, 1.3 region. And so this is not where we want to be. This is where you have an epidemic happening. This is where you have folks, spreading from one another, and this is where you're seeing the viral transmission decrease. And that's definitely where we want to be. And right now, we're just a little too close for comfort. And when you look at the states that are involved, or the regions of Louisiana that are involved, you can see that those regions really consist of, thankfully, not anywhere where it seems as though where it originally happened, which was mostly in Orleans and Jefferson Parish, which is mostly around here, but you're starting to see it kind of now spreading around into more of the rural areas of Louisiana. And this is not unlike what we're seeing with different parts of the country as well. If we look particularly at Orleans Parish here, you can see that we are definitively in a great space, that our rates, even though the margin of error still dips over 1, we are well below this minimum threshold of 1 right here. That means our R naught is less than 1. That means that theoretically that there's a minimum amount of infectivity that's happening pretty much on a regular basis. And that's kind of where we want to be right now. This is the Orleans specific dashboard that you see particularly right here. And let me just highlight a couple of things right here. This is looking at our daily number of new cases, and you can see at least it's very sporadic. It's not happening in a regular basis. Our number of new deaths, this is again in blue is Louisiana, the state of Louisiana, and you can still see that we are still seeing some minimal blips of mortality happening in Orleans Parish. When you're looking at the number of new tests, you can see that that Louisiana really spiked up with their number of new tests that have happened as well, and Orleans kind of remains more or less stagnant, but good. When we look at the number of ventilators in use, I'm trying to do two things at once. I hope you guys don't mind me. So this is looking at ventilators. This is looking at ICU beds, and this is looking at hospitalization. And we still have plenty of ventilators. Our ICU beds are about half filled and about 3/4 filled in terms of hospitalization. As we just wrap up this segment really quickly, as Doc Griggs was talking about, I'll let you talk about this, Doc Griggs, if you want. This is looking at Brazil.
Yeah, this is looking at Brazil, and you notice how it looks like. Looks a lot like our curve when we started back in March. What's happening in Brazil right now is happening in their polar opposite seasons. Expect this in our fall, winter if we're not careful. They're going through their first spike, and believe it or not, we are too. If you look historically back at the pandemic data, you'll notice that the spikes went up and down, and it was all based on our behavior. There's a lag in the number of deaths behind the number of cases taught. There are a number of factors counted, rather. There are a number of factors that factor into how many cases you have, and that's supplies, availability, people that are tested in the hospital. But the number to look at is the number of deaths, because deaths always follow the number of cases. And you can see the trend of all of it going up and spiking up, because the ability to properly social distance and do the things that are necessary to slow this thing down is not happening. The things that we have to understand, even though we seem to be in a good spot when the numbers went up, every time the numbers go up, they go through numbers. When they come back, they have to go down through the same numbers. And the speed of which and the rate of available supplies to support the cases and the deaths is dependent, 100% dependent on our behavior, because the virus has not changed. We still don't have we have a diagnosis, I'm sorry. We don't have a vaccine, we don't have a treatment, and we do not have a cure. The only thing we have, we know that works, which is why we're in the position now to open, is social distancing and staying at home. Doc?
I think obviously social distancing, staying at home, incredibly important. Let me just kind of wrap up this segment really quickly, and particularly when we are looking specifically at the number of cases. What I do want to bring up with these number of cases is that Brazil once again had a maximum number of cases that occurred again yesterday. So they are going up and up and up, and there's no, unfortunately, that curve just does not seem to be going down. You can see the mortality as well seems to just be going up and is not going anywhere near as to being down.
Doc, wait, before we get to this slide, can you explain to people why you've had us following Brazil for some time now? Why Brazil?
We also learned more today, specifically about the what's happening at some of the other and some of the most number of we've had the most number of cases, like we said, that was reported by the WHO today. That we exceeded 106,000, over 100,000 new cases, and the 100,000 new cases came. 2/3 of those came from 4 countries, and those 4 countries were the U.S., Brazil, India, and Russia. And when you think about the leaders of all 4 of these countries, so we're talking specifically about President Trump. We're talking about Prime Minister Modi from India. We're talking about Putin, and then of course we're talking about President Bolsonaro, who's known as the Trump of the tropics, and what we who is the president of Brazil. And what we've seen is all 4 of these individuals all called the SARS-CoV-2 virus, COVID-19, a hoax. They claimed that it was not real, and they were very slow on acting on what's happening. I've been particularly interested in Brazil because, of course, and in fact, all of these countries, particularly Brazil and particularly India, we're talking about very, very, very high rates of poverty and very high rates of a broken healthcare system and a lot of neglect. And what we are doing here in the U.S. is really modeling, I think, what's happening in the rest of the world, particularly in India. When you look at the folks that are our president, President Trump, who he appreciates and who he kind of always speaks highly about on the national stage. It tends to be Narendra Modi, who is the Prime Minister of India, of course Putin, and of course Bolsonaro. So it's hard to not look at what's happening in India and what's happening in Brazil and not see a reflection of what's happening here as well. And again, like we said, it really hurts the heart. And so, Doc.
No, so that's everything that we've been talking about. Like, if you do not respect this virus, here's the thing. Even though we've opened and we're in phase 1 and all states are doing some version of it right now, please use your common sense and keep yourself safe. Understand that there is no cure, there is no vaccine. The only treatment that we know of that works is to social distance and stay home. If you don't feel like you're safe going out, don't go out. Please stay home, wash your hands, and wear your mask. My mask is to protect you from me. Your mask is to protect me from you. We're in this together. We're part of the same herd. Until we can find an artificial immunity, we really don't want to have to go through this herd immunity, because who are you going to sign up to be the member of your family or love circle that dies?
That's exactly right. Doc, we have a comment here that I wanted to see if you wanted to comment on. And it's here. It's from Ms. Carolyn, and she says, the whistleblower scientist in Florida says she was fired for not fudging her numbers. I know this is something that you and I have talked about. Is that a story you want to comment on?
Well, it's the truth. She got fired because she wouldn't change her numbers. It's a story that's already out there. Basically, they wanted some of the data to match their policy.
Reality.
Yeah, right. To match the policy of which they did not want to comply, and she wouldn't do it. So I don't know if it's a whistleblower or just an interview where she told the truth.
Well, oftentimes, what's the difference? Right. Isn't that a shame? Where if you now have to tell the truth, you're now just deemed a whistleblower.
Yeah, the science never loses. in 50 years, I've never seen a situation where it happens that every now and then science will not win, or something will be proven wrong. But generally, science, Mother Nature wins. With no vaccine, no cure, with social spreading, this virus has been very consistent to itself. That's the one thing we know about its behavior, that A, it's not going anywhere. B, it spreads when we have super spreader events and people congregate, that you can pass it. It's a respiratory virus. The CDC came out with another observation, I'll say, to say that you're less likely to catch the virus, contract the virus from touching the surfaces. Well, we already knew that. The likelihood to be exposed to a viral load or enough of the virus to make you sick is higher if you breathe it in, if you take in saliva particles, if you do things to get into your nose and your mouth directly, than it is for you touching something and touching your face and then inhaling it and allowing it to get into your respiratory system that way. However, I want people to be very clear. They're not saying that you cannot contract the virus this way. We still need you to disinfect the surfaces. We still need you to wash your hands. I'm going to tell you this, don't forget anything. And all of the opening and the stuff that we're humanly doing, understand the virus hadn't changed and it isn't going anywhere. If you can imagine a fog or a haze in the air when you walk outside, and that you're breathing it in and breathing it out and it's totally surrounding you, that'll tell you what you need to do to protect yourself, and why you need to wear a mask, and why you don't need to be so close. If you breathing in that fog and you're talking to someone and breathing it out to someone, knowing that it'll go down in 6 feet. If you talk louder, it'll go further. You need to wear a mask. You need to wash. When you get home, you have your outside clothes and your inside clothes. Understand nothing has changed about this virus. Doc?
Yeah, of course. What that reminds me of course, is this that I will share with you, because we talk about it all the time. This is what this reminds me of, right? Like is that what you're referring to? Oh, it just went.
It is, especially if you can imagine that dust being aerosolized, it's right. Being in the air. People are very familiar with pollen. So imagine outside just being hazed up with pollen and it being everywhere, to the point, or like paint dust when you're painting a house with a sprayer and you don't want to breathe it in, but on a micro level. Right. Imagine being able to inhale it and then spit it out. If someone can smell your breath, then you need to back up and you need to wear a mask.
That's exactly right. Also, let us also say that if you do have questions, we do appreciate questions. We are answering questions live on air as well. So if you have comments or questions, we can definitely see them as they come along, and we're happy to answer that. Let's move into some more going over some of these stories. Doc Riggs, I'm going to be calling on you.
So glad that you backed up. Yeah, I'm glad I'm social distance. I saw that.
Yeah, you're right. All right, so here's some stories for us to go over, Doc Riggs. As states reopen, efforts to ramp up testing have been hampered by fragmented health system. Any thoughts on that?
Now, we've had an issue from the very beginning with supply, demand, and resources. The more testing we do, the more resources that we'll need. In a positive shout-out type note, here in New Orleans, we started mobile testing in Treme, actually in the Lafitte Senior Community Center. They have a mobile testing site set up where they're doing hundreds of tests a day, making them available for walk-ups. Rather than the nasal swab test, that feels like it's scratching your brain, but necessary, there's an oral saliva test that you can self-administer right there on the spot. It started today. They're going to be doing these pop-ups and have these sites all over the city. Just go to readynola.gov. I'll post on my Facebook site and my social media sites, but there's a lot that goes into testing other than testing. There's a lot of lemons to go into the juice, if that makes sense.
No, it doesn't. But that's
only to you it doesn't. You probably don't even drink lemonade, do you?
No, but weren't you supposed to share something with me? Like, didn't Graylin want you to be sharing something with me? Like some candy? What was the thing that you were supposed to go and like take me out?
Oh, you never had a huckabuck. This guy's never had a huckabuck or a frozen cup or a freeze cup. Man, don't.
Listen, if anybody's listening,
this guy
never. Anybody know what a huckabuck is? Or
they know what a freeze cup is, and they know what a frozen cup is.
If you don't know, let us know. A huckabuck. That sounds like
easy now, Doc. I played about revoking your card earlier. We will take your Louisiana driver's license. We'll take we'll change your residence. Easy, buddy. Easy now. Easy, Doc.
Man, you saw where I was going.
Next topic.
I do also want to say one or two words.
Yeah.
Huckabuck. Yeah. When are you going to hook me up with a huckabuck?
I'm telling you.
So listen, we have an incredibly fragmented U.S. healthcare system. I've said it for many, many times, healthcare for all. Healthcare for all, healthcare for all. Health is a human right. And this is such an incredible example of, and one of the things that COVID has shown is that our broken healthcare system and how much we really need to fix our healthcare system. Here you can see the U.S. Provided up to $1.2 billion to a drug company to develop a vaccine. Again, we are seeing more and more unemployment benefits being a request. Let's see. Look at this. This is shocking. Trump has made inaccurate claims about hydroxychloroquine. Thoughts about that, Doc Griggs?
We knew that we knew our stance on hydroxychloroquine. We knew that's water is wet news.
With this is that it's important for us, I think, to continue to report on this sort of stuff. And I appreciate you are seeing a media that's more bold than ever to be able to say, because hydroxychloroquine is dangerous in the wrong host. It's life-saving in the right host, right, for lupus and for rheumatoid arthritis. Lastly, I wanted your thoughts on this. Scientists predict a busy Atlantic hurricane season amid a pandemic. What are your thoughts about that?
Of course we do. So let's just talk about that for a second. Was this not in New Orleans one of the nicest weather-wise, even though we weren't outside, weather-wise springs we've had in a long time? It was 60, 70 degrees. It felt like we were at the beach. The earth got a chance to actually heal some of the damaged ozone. A lot of places that were overly warm cooled down. So you've caused pressure changes. You've done a lot of things to alter the ecosystem. So you're going to see the consequences of it. And sometimes it results in hurricanes. Hopefully it'll be busy, but it won't be disastrous.
Yeah, I'm sorry. I'm trying to get rid of this.
We're learning.
I'm trying to get rid of this text. Graham, can you help me get rid of this? I didn't mean to. Here.
You're good now.
What's
You're good.
Thank you. Chris Lucas and I went to medical school together, so I appreciate Chris is here. I don't know how to get this off. If somebody can help me get this off, I would appreciate it.
Right now, the screen is the two of us.
So no, you don't see what I see?
No, we're good. Just keep going.
Okay, good. All right. I see. Hey, Adrian. I see. All right, good. I'm glad you can't see it. I didn't realize it. I don't know what that is. So that's fine.
Oh.
He says you can't see it. Nobody can see it? Okay, cool. All right, cool. That's meant for, I got it. Okay, cool. All right, so let's continue on. I got some stories for you, Griggs. What? Oh, sorry. Hang on.
Go to captions.
Captions, right?
And then, I don't know.
Yeah. All right, that's fine.
I don't know.
All right. We'll deal with that. All right, Doc Griggs. So in light of what you were just saying just now, a moment ago, I have something for you here that I wanted to present to you, which is this. It says here, COVID-19 and surface contamination. And this is as a result of multiple studies, and it shows that the virus that causes COVID-19 can persist outside the body and may linger on some contaminated surface longer than others. Regularly decontaminating surfaces where patients live or care for, as well as high traffic public areas, could reduce transmission. The idea being is that it can persist outside the body and may linger. But I'm going to show you the next story, which is going to essentially show that that's not necessarily the case. And I think that that is right. Oh, it didn't make it into the rundown here. I'm sorry. We are continuing to learn here. But, you know, I think it's important for us to realize that this exists, but it's not quite as much as we thought it is. What's the matter? Yeah, it is there, right? we're trying to, how do I get rid of this? Hold on a second. Graham is jumping in here really quickly to help us out.
Messages.
Okay. Okay, thank you. I don't know what you just did, but we'll figure it out later. All right, so here's the changing landscape of COVID-19. The rapid development of diagnostic tests for SARS-CoV-2, the virus that causes COVID-19, has raised important questions about what tests should be used in what circumstances and how much the results can be trusted. Recent changes in expert guidance on diagnostic testing are not uniform and may reflect rapid concurrent evolutions on research, development, scientific knowledge, and logistic constraints. So any thoughts about that? I know that we have talked about testing. It's something that comes up pretty regularly. Any thoughts about that?
So yes, that is absolutely confusing, and I get a million questions a day about what does all of this mean. The bottom line is what you're concerned about is we're worried about virus testing. Virus testing. When you hear PCR, nasal swab, oral test, that's virus testing. We want to know whether you're positive or negative. We can talk about antibodies and serologies later when we get all of our stuff together, because we have no idea what it means. Right now, it's an academic exercise to say that you might have been exposed to the virus. You might have actually survived the virus and been asymptomatic the entire time, looking at IgM and IgG, but we don't even know how long the immunity, if there is any immunity, we don't know how long it will last, even if you're IgG positive. Remember, IgM is the main one we're talking about, and IgG is the patrols to see if it comes back that can protect you long term. That's a principle that vaccines are built upon. That's a principle that when you hear about convalescent plasma, for those people that have recovered from the virus, donating to help those that might have it right now. We'll put all of that on a shelf and watch it, on a burner and watch it. But the main test we're talking about right now, when you hear testing at all the mobile sites, and we need to do more testing nationwide, that means we need to do more positive or negative testing of whether or not you have the virus. Doc?
Yeah, no, that's absolutely right. And that's important. You know, one of the questions that we get a lot of is how to engage in testing, repeat testing, testing at work, and this sort of stuff. Any thoughts about? I know that's that's largely due to the fact that we just don't have centralized guidance on this.
So the thing to trust, though, to understand, is the most honest scientist, physician, diagnostician, whatever you want to call them, will be the one that tells you, look, we don't know. We can tell you what the science that we know about dictates, but we don't have guidelines. The CDC put out the guidelines. The 62-page document is out.
They went rogue. Explain how they went rogue.
Well, yeah, right. They went rogue and put it out anyway. They quietly put it out, even though they were told not to.
Not to put it out. They put it out anyway.
Put it out anyway. And
which is amazing if you
digest it yet, to see what standards would be. But we know, based on science, immunology, our history with respiratory viruses in the past, what we think. But right now, there's no standard. So we all are defaulting back to CDC and our experiences, but I do think that there will be some sort of standard coming.
I hope so. And as of right now, we don't know what that is. But we will hopefully, once we do find out, we will definitely be able to resort to you guys and let you guys know as well. Doc Riggs, this is a story that you and I have been following for some time. It's this idea of immunity certificates, fundamental knowledge gaps around the human immune system and their response to SARS-CoV-2, which preclude governments and other institutions from implementing immunity passport programs. Due to the scarcity of scientific evidence on the protection that antibody immune response provides against COVID-19, look at this. Expert guidance recommends against immunity passports for these and other reasons, or any potential passport immunity program that would need to address a variety of ethical and legal issues. Doc Riggs.
So that speaks for itself. As I was just saying, we have no idea how long the IgG lasts. If there is immunity, we don't know if you can be reinfected, and we're just not even going to talk about the ethical and legal issues with the civil liberties and the potential things that could happen and the xenophobia and this is your chance. Say it,
Pathogeoxenophobia.
Oh man, I don't even know why I brought it up.
Down with pathogeoxenophobia, baby. Down.
Don't even bother to Google it because it doesn't exist yet. But I trust me, he's working on it. It's discrimination based on a COVID-19 process, and we know that's wrong. But again, the science doesn't support it. So
this is a little bit of an older story, but I figured let's take the time to do it again because I think it's so important as people are starting to go out. This is an attack rate following exposure at choir practice in Skagit County, Washington. Augmented transmission from a choir singing practice, resulting in 52 secondary cases, 2 of which died. This was considered a super spreading event. Doc, any thoughts on this?
They were not practicing social distancing. Out of 60 people, it was actually 122 divided into 2 sections of 61. 52 became infected with the virus from one person. Being in a choir is dangerous for a number of reasons, especially if you're not practicing social distancing. But as you sing loud, your voice, the tone, as your volume increases, the amount of air you expel increases, as do the number of respiratory droplets that could contain the virus that you could breathe in if you're not wearing a mask. So there's so many things that actually took place to show the effectiveness of the virus, the infectivity of the virus, and the importance of wearing masks and social distancing, but most importantly, staying home and not congregating.
That's right. And of course, the importance of continuing to wear masks whenever possible. All right, this is, we got 2 more stories, and unless we have anything else, we'll wrap up. This is a story that you and I talked about earlier today, which is coronavirus hotspots are erupting around the country, and experts warn of a second wave. Let's focus on the first story first. Here, let me see how this is blowing up. If this is, this is still hard to read. We're still learning this software, guys, so I appreciate you guys being patient with us, and we're gonna have to definitely do something a little different next time. But you can see Dallas, Houston, Southern Florida's Gold Coast, and the entire state of Alabama, and several other places in the South have been rapidly reopening, and now their economies are in danger of a second wave of coronavirus infection over the next 4 weeks, using cell phone data that tracks social mobility and forecast the trajectory of the pandemic. Let me also say something here that I think is critical, and that is right now the state of Alabama is completely under a coronavirus siege. There are no ICU beds in Montgomery at this time. Think about it. In Montgomery, so if you're sick in Montgomery, Alabama, there are no ICU beds. You will be sent somewhere else. So what we're seeing in particularly in these four cities throughout the South, and just to go over them again, what we're particularly talking about here is Dallas, Houston, the southeast Florida, and again, the entire state of Alabama is just really is something that's horrific. We predicted this. We said that this may happen, and of course, we really are starting to see this go down. When we talk about this second wave happening in the South, I just also want to bring your attention that this is also happening in rural parts of America, including counties in Crawford, Iowa, as you can see here, and Colfax, Nebraska as well. And I want you to pay attention to the fact that what we are particularly seeing in these particularly rural areas is in Crawford, Iowa, an increase of 750%, and in Colfax County, cases increased by 1,390%. And this is a tremendous amount that's happening right now. And to underscore the importance of this, of course, these are happening in rural areas, and as we have talked about many times about what happens in these rural areas are notable for the fact that these are places where hospitals have long since left because of the inability to generate revenue, make profits, if you will. There wasn't rather than feeling a sense of duty and service for a community. Of course, the healthcare system that just continues to dismantle, especially in rural parts of America, especially in poor parts of America. These are also individuals that tend to be older, poor, and also have chronic health concerns as well. And so what we're seeing there is really a disgrace in some of these rural areas with respect to the healthcare system. And what we're also seeing is really difficult because we are going to see a lot of pain and suffering, much like what we saw in different parts of the U.S. Any thoughts there?
No, I have no thoughts. I just really we're talking about second waves, and we have to be careful because I don't want to be deceived into thinking that this is the second. The second wave there's still another wave coming. And as Dr. Dare, you know, it tends to go. Nothing is a straight trajectory or a straight down trajectory, especially when it comes to human behavior. There are things going on in other places that we're not knowing about, and this is one of the important things. This is not just an urban area problem. Remember, the virus doesn't spread the virus. The virus spreads by people. And wherever there are people, including the rural areas, if you come to an overpopulated area, and I'm saying that because this is Memorial Day weekend, and if you go to places and congregate in places other than your home or your home city, not only will you bring that potential virus, asymptomatic or not, back to your hometown, you'll bring it to your home, your house, and potentially infect those that you're in most contact with for the longest period of time. So be smart and be safe.
Right about that, yeah, you're 100% correct. The last thing that we want to do is I just want to go over this. This was the case that I was telling you about a moment ago. I'm not sure how well we could see that. I am going to do this, and what this shows here is more than anything else is that viruses do not spread easily from contaminated surfaces or animals, revised CDC website states. The coronavirus primarily spreads from person to person and not easily from a contaminated surface. This was the takeaway from the CDC, which this month updated how COVID-19 spreads. The revised guidelines and headline size type said the virus spreads easily between people. It also notes the coronavirus, which causes the disease COVID-19, spreads very easily between people. So again, the virus does not spread easily in other ways, and this is something that I have been railing about, particularly about how the virus spreads. It is overwhelmingly a respiratory virus, overwhelmingly. And the idea of having, of surfaces, and of course it's important to clean the surfaces. Of course it's important to maintain that disinfectant and try to be as sterile as possible. But the important thing here is that you have to wear masks. The mask protects you. This mask protects you, and your mask protects me. So please mask up, COVID down. It's so incredibly important that folks continue to wear their masks. It's not all the boxes and the groceries and all the stuff that you do. That's great, 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 great. But overwhelmingly, this is a respiratory virus, and I'm glad that that the CDC has finally updated their guidelines on that particularly.
Bottom line is wear your mask. We're not saying that we want you to stop washing your hands. We're not saying that we want you to stop wiping down your surfaces and keeping as clean an environment as possible. We want you to wash your hands. Even though it's harder to spread, they're saying it is possible for you to touch your nose and mouth over a sneezed surface. So the important thing is, again, is to wear your mask. Wear your mask. Mask up, COVID down.
Doc Griggs, any last words?
No, as usual, breathe, check, step back, and get checked, get fit, get moving. Wear your mask.
Wear your mask, wear your mask, wear your mask. Remember, health is a human right, and more than anything else, peace out. You got it? Here, put it in the camera. There. If you're going to do a peace out, you got to make sure your peace out's actually in the camera, okay?
Yeah, get off there, Cam.